In the acne world, I think I barely missed a beat, with my acne patients. And it was great that even iPledge kind of loosened up some of the requirements for us. For example, it was very strange to be seeing somebody who was following up for isotretinoin, which is the Accutane product, although we don't have that brand anymore, but they'd be following up for that, and we had to have a negative pregnancy test. And that's always been a big deal, and it has to come from a CLIA certified lab. And now we were telling people go to the pharmacy or the drugstore or the wherever it is you go buy a pregnancy test, a home pregnancy test, and then they would just hold the result up in front of the camera so that I could see it. And that otherwise would have been a real barrier, but we were able to even overcome that. The other things that I think were good about it is, and I've said this to people before, it was really interesting. Sometimes when you're in a clinic visit, people are confused. You'll talk about, are you still using those two topical medicines? And they'll say, now hold on, which one is in the yellow and which one is in the blue? And I don't always remember that myself. In this case, I'd say, can you go to your bathroom and pick those up? And I want to see those two products that you're using. And so there were opportunities for us to maybe even do that better. I did miss, touching my acne patients. That is still important because so often the patient sees little red and purple spots on their face, but that's just kind of leftover staining that's going to go away. The acne itself is better. And so I would sometimes say to the patient or to the patient's parent, can you rub your hand down that and tell me if you still feel anything there? So best practices in a nutshell were things like acne and rosacea. There were areas where I think we didn't skip a beat on that. There were a few areas where I missed being able to interact more directly with the patient.